Well, despite how often we have our kids brush and floss their teeth, studies show tooth decay is still the most common chronic disease in children.
It's estimated that half of all kids ages 2 to 11 suffer from it. And now, new recommendations suggest that primary doctors get involved in dental care. Most children ages 5 and younger don't see a dentist, and not surprisingly, tooth decay is on the rise in this age group. To help reverse this trend, new recommendations now suggest primary care doctors apply fluoride treatments to the teeth of all children 6 months old to the age of 5. Doctors should also prescribe oral fluoride supplementation to patients who are not getting fluoride in their water. The thinking is that children are more likely to see a doctor earlier in life than a dentist. These new guidelines were put out by the U.S. Preventative Services Task Force. Tooth decay is 4 times more common than childhood asthma, 7 times more common than hay fever. That's according to the report. About 1 in 5 children with cavities doesn't get treatment. It's not only painful, but can lead to loss of teeth, slower weight gain, speech issues, and problems with self-esteem. Dental experts recommend that little ones start seeing a dentist no later than their first birthday, that they brush at least twice a day, and get a checkup every 6 months. Now, you may be wondering why so many kids have dental problems. Experts say that it's because they have a thinner enamel, which can be more susceptible to bacteria. And you and I were just talking off camera, and I haven't gone to the dentist as often as I should. I really do need to get back.
I know,
Yeah.
and you're not alone. A lot of adults do not go to the dentist. They just don't like the noise, the drill, the needle, all of those things that just make you go, ooh. Well, what if you could get your dental care without the pain, or get this, the grinding sound of the drill? Well, you can, thanks to laser technology.
Walk into any dentist office and you'll find pretty much the same tools. Walk into Delmarva Dental Service, you'll find something new, a laser.
Lasers, as you know, you see lasers in industry, you see lasers in medicine, even the veterinarian has lasers. And they're used for a variety of purposes. In dentistry, we can use lasers anywhere from diagnosing a cavity all the way to cutting tooth structure. We can use it to alleviate pain. We can use it to numb. We can use it to stimulate healing. We can use it to cut away soft tissue.
Dr. Ray Makowske of Delmarva Dental Services adds laser technology in dental care goes beyond your teeth.
Examples are, for instance, people come in with muscle pain. We'll literally just shine a laser across there. It'll relax the muscle. It'll stimulate the healing. We'll actually shine a laser inside the mouth after we've done a traumatic procedure to help prevent things from exacerbating into pain. That's, to me, is amazing. Literally a 30-second shine of a laser in there, and people don't have any post-op pain.
And the knowledge of knowing you can be pain-free without a needle or drugs will likely be comforting to people who let anxiety keep them away from the dentist's office.
And I'd say between 30 and 50%. I mean, we have an interview where we interview people on what they dislike about the dentist, and of course the needle is probably number 1, but number 2 is noise.
And speaking of noise, the loud grinding sound of a drill is replaced by a sound that some describe as a popping.
And that popping noise sounds like, I tell people it sounds like popcorn. And what it actually is the water being vaporized by the laser, and that's what creates the energy that creates the cleaning or the eroding type action for it to do its job.
The dentists at Delmarva Dental Service say the laser cannot completely replace the drill. You can't use a laser beam on metal like fillings. And the lasers don't do the job as quickly as a drill. But some may call that a good trade-off. Another advantage of laser technology is its ability to sterilize.
And lots of times you can have a perfect root canal and the thing fails because there's still germs hiding in the little nooks and crannies. So every time I do a root canal, pass the laser down there for just, you don't have to do it for 30 seconds. That kills the bacteria and also conditions the inside of the tooth so you get a better bond with the filling material.
And the list goes on. There are even cosmetic advantages to lasers, such as teeth whitening.
The laser beam can, just like it activates the water when you're cutting tooth structure, it activates the bleaching solution, makes it more potent.
Laser technology can also zap mouth ulcers and cold sores.
Can you imagine if you were going to your wedding was in 2 days and suddenly you feel this boo-boo coming up on your lip? You know, you're like in a panic. And you come in, we literally can shine that laser on there for 90 seconds. It'll stop it dead in its track. I know I've had it done 3 times myself.
Dr. Makowske says lasers will definitely change the way dentists operate, and even better, this is just the beginning.
And Dr. Harmon says lasers are also used to treat gum disease. He says there's less swelling and bleeding. And if you would like to read more about Delmarva Dental Services, visit our website, DelmarvaLife.com.